Hey guys! Alright, so have y'all ever walked into a room and not know why you were in there in the first place? Or have you been on the phone talking to someone and realized, where's my phone? And it's in your hand? Well, imagine that times 100 because that's exactly how Alzheimer's feels. So, my name is Dana and in our group is Bree, Drea, and Maggie. And today we will be discussing how exercise can slow down the progression of Alzheimer's disease. First, we will be breaking down the disease along with the causes, symptoms, and risk factors. But ultimately, our focus today is to prove and demonstrate how important exercise really is to prevent the rapid progressive of Alzheimer's. Alright, so for those of you who don't really know what the disease is, it is basically a disease that robs your memory. It starts slow at first, like forgetting little things like what you had for lunch that day or what you have planned for that day, and then it can progress to more important things like forgetting your loved ones, which is really, really sad. Alright, so the disease makes the brain tissue break down over time, therefore the general population that usually gets Alzheimer's disease is the older population, but women are more diagnosed than men. And researchers have found that there are two main things that are a common cause of this disease. One are the nerve cells in the brain getting all tangled up, and the second one is just the plaque building up in the arteries of the brain. Therefore, those who have high blood pressure or high cholesterol, they are at greater risk for developing Alzheimer's disease later on in life. Unfortunately, other risk factors like family history and genetics can't be changed. There are multiple symptoms relating to this disease, and there are usually trouble focusing, confusion, dramatic mood swings, poor coordination, and trouble communicating. Although scientists are still testing out these theories, they believe that the biggest risk for Alzheimer's disease is age.
Hi guys, my name is Brianna and today I'm going to be going over some case studies that basically prove that exercise can either prevent Alzheimer's disease or can decrease the progression of the disease. And so the first case study I'm going to go over is a study done by the Journal of Neuroscience in 2005. And what they did was they took mice and over 5 months they put them through a voluntary exercise program. And after 5 months they studied the brains of these mice, and in their brains, they found that this amyloid B plaque, which is a precursor for Alzheimer's disease, was decreased much more than the rats that were not put through the voluntary exercise program. So basically what this study showed is that through exercise, the brain was better able to deal with these plaques and was then able to decrease the progression of Alzheimer's disease. So clearly, through voluntary exercise, and through further study, of course, on humans, it can be shown that exercise can actually be a preventer and something that can slow the progression of the disease down if used in the proper way. All right, the next case study we're going to look at is a study done by the Journal of Alzheimer's Disease in 2010. And basically what this study was looking at was if regular physical activity, as shown by the ACSM guidelines, could actually improve the health of the brain. And what this study showed was that regular physical activity can actually help increase the endurance of the cells to oxidative stress. And basically what this means is that the brain was just overall healthier. And when your brain is healthier, it's better able to deal with the risk factors and the precursors that lead to Alzheimer's disease. So essentially what this study showed is that regular physical activity can help prevent Alzheimer's disease. And even if you're genetically predisposed to it, it can help slow the progression of the disease. So clearly exercise is really important to either preventing Alzheimer's disease or slowing the progression of the disease itself. The next study we're going to look at is a study that was done in 2012. And what this study really was a 1-year randomized control trial. And the trial was basically just putting in a simple exercise science program into a nursing home and seeing how these patients would react. And the main goal was to see if they could decrease the progression of the decline of their activities of daily living scores, or ADL score, and if they could decrease the happenings of depression that is typically associated with Alzheimer's disease. And what this study found is through a simple exercise program that includes like walking and jogging and body weight exercises, 1 hour twice a week, they were able to see a decline in the decline of the activities of daily living scores, and they were also able to see an increase in the mental health of these patients. And so through that study, they were able to see that exercise implemented into the nursing home and into their daily lives basically was able to help their mental health in many different aspects, including their memories. And this exercise program also helped the patients in the nursing home to the point where they were doing better than patients who were receiving routine medical care outside of the nursing home. So through this study, we're able to see that exercise being implemented into the daily lives of these Alzheimer's patients can actually help decrease the progression of the disease itself. The next study we're going to look at is a study that was done by the International Journal of Sports Medicine in 2008. And what this study was a 12-week trial that had both a group that was going through an exercise program and a group that was not. And the group that was going through the 12-week exercise program did an exercise program that included both aerobic and resistance exercise and also had a focus on balance and gait training. And what this study found was that the group that went through the 12-week exercise program saw significant improvements in not only their gait and balance, which led to a decrease in falls, but it also showed that they had a lot more upper and lower body strength, and they were better able to perform their activities of daily living. And so it also needs to be noted that the group that did not go through the exercise program saw no change in either their strength or their gait or balance. And so what this study basically says is that exercise needs to be implemented in overall medical and nursing home care for these Alzheimer's patients because they're seeing so many benefits from it, not only physically, but also mentally in performing their activities of daily living as well. The last study that we're going to look at today is a study that was done by Geriatrics and Gerontology International in 2012. And what they wanted to look at was if a multimodal approach, which basically means that you would be doing physical activity and cognitive activities in the same session, could help Alzheimer's patients. And so what they did was they had patients come in for a 1-hour session 3 times a week for 16 weeks, and they had a control group that did their normal daily activities for the same amount of time. And they found that the people who actually participated in the multimodal program experienced extreme improvements on all of their memory testings that are required for Alzheimer's patients, such as the frontal assessment battery and the symbol search subtest. And so these groups decreased scores in multiple different memory testers, while the group that was the control group and didn't do any of the multimodal program saw no change or a decline in their scores.
Okay, so today I'm going to talk a little bit about how exercise and other stimulations can be implemented in the life of an Alzheimer's patient. A little bit of a story: my grandmother was diagnosed with Alzheimer's and she passed away at the age of 71. When she was officially diagnosed with Alzheimer's, she was about 68, but when my family and I started looking back at her actions and her habits, we pieced together symptoms that showed up 10 years prior to her death. Along with Alzheimer's, she also had congestive heart failure, COPD, and emphysema. Most likely all of those were caused by the amount of cigarettes that she smoked every day and throughout her life. So she was diagnosed with all of those around the age of 57. And during my research, I saw that there were 6 pillars of exercise that corresponded with people with Alzheimer's. And this article that I referenced was written by Melinda Smith, Lawrence Robinson, and Janine Siegel. And all of these three people had successful backgrounds in psychology, and they published many articles that referenced mental health and how to slow the progression of mental deterioration. So the 6 pillars that they talked about were social engagement, exercise, a healthy diet, mental stimulation, sleep quality, and stress management. And I'm just going to talk about the few that directly relate to exercise and general health. So in regards to exercise, the individuals who exercised and generally stuck to the FIT recommendations for older adults, they reduced their risk of developing Alzheimer's by 50%. But if they already had Alzheimer's, they slow the progression of the disease. So the general FIT is about 150 minutes a week of moderate to vigorous exercise, and the exercising that should be done should target the major muscle groups. So exercise like walking, cycling, and swimming would be ideal. But however, if you are working with a patient that is overweight or isn't that good in their cardiovascular health, you could walk just for about 20 minutes a day just to increase their endurance until they are able to handle 150 minutes a week. Just some sample exercises for older adults could be simply just walking around the neighborhood or going to the mall, gardening, sweeping, water aerobics, and chair squats. So for mental stimulation, the brain needs to learn new things in order to remain active. So simple tasks regarding that would be painting, reading, sewing, memorization games, crossword puzzles, and Scrabble. And for someone who's forgetful, it's important for their caretaker or their spouse to implement these games and exercises, because for someone with Alzheimer's, they don't know that they have it, so they don't know that they're forgetting. So that's why someone needs to be there to remind them to do an exercise or sit down and play a game with them, just to keep up and maintain a regular schedule. And this also applies to exercise regarding a caretaker. And a suggestion that I thought about was leaving notes around the house, with times to do something, or reminding them to do their exercises, so leaving like post-it notes. But this is adjusted to every individual, and every Alzheimer's patient is different. Because in my grandmother's case, she threw away everything that was in the house, so leaving a post-it note wouldn't have been a good idea in her case, because she would just throw it away and not even read it. So like with a spouse or a caretaker, you can set up times around the house or to go to a class, so you can start cleaning, sweeping, go walk around the neighborhood, just something to get them up and out, and they don't really think of it as you're going to exercise, they just think about it as going to walk around. So these are all really simple things to do, because sometimes with older adults, 65 and older, they can't do extremely vigorous exercises, so you have to work up to it or just maintain a healthy pace. And it's important to the health of an individual with Alzheimer's that they just get up and walk around, do chair squats, chair exercises, and this will help them with their mental state as well as their physical state.
In conclusion, Alzheimer's is a serious disease when it comes to older people, but studies have shown that exercise can decrease the effects and inhibit the progression of Alzheimer's. Exercise in individuals with Alzheimer's has proven to improve an individual's ability to perform daily activities, physical performance, and nutritional status, and also decrease behavioral disturbance and depression. This is why exercise is highly recommended when it comes to Alzheimer's. The chance of it occurring is 14 times higher in people older than age 85 compared to those aged 65 to 69. As said before, exercise can also help the body physically when it comes to balance, agility, flexibility, and decreased chance of falls. So when it comes to exercise, dieting, and daily activities when getting older and developing Alzheimer's, there are some things that need to be remembered and done. These things include beginning exercise at a low to moderate intensity, which, for example, walking for 20 minutes, then progressing to jogging, the treadmill, and/or cycling. If individuals are strong enough, progress their resistance training 2 to 3 days a week. It is also important to be social, make friends, and join clubs. Also, have a healthy diet, cut down fat, and lower carb intake. Limit your sugars and increase omega-3 fats, which are found in fish and fish oil. Lastly, exercise your brain by reading, doing puzzles, painting, and/or sewing, and also doing memory games like memorizing states and capitals. These will help to strengthen the brain. Overall, all of these can prevent the onset of Alzheimer's and slow the progression if a person already has it.
That's all, folks.